Welcome to Being Social. So today we have Dr. Madhavi.R, who is proficient in infectious category. So as you know, the COVID-19 is really popping up across the countries, and definitely everyone are panic, and we wanted to know what are the symptoms, how it has arisen, and what we need to be aware. So please watch this video from Being Social and get more information.
I'm Dr. .MADHAVI.R, currently practicing in infectious diseases for the past 18 years in Atlanta, Georgia. Board certified in internal medicine and infectious diseases. So we all have to be concerned about our community spread of COVID-19. And it has years, but the main strain has gotten attention and caused a pandemic outbreak, which started in China in November of 2019. So coronavirus belongs in rhinovirus family, which causes common colds. Why only COVID-19 has been more dangerous? Never been detected until November of 2019, which started from a live seafood market in China. So initially the assumption is that it passed from an animal, live animal, droplets to a person, and then from there on the humans became the host. There are 4 types of coronavirus, and it has been detected a couple of different strains in 2002 and 2012 with SARS and MERS. Both of them have similar consequences, just like COVID-19. What do you look for COVID-19? Well, how do you get it? It's mainly person-to-person spread, and usually people who are immunocompromised are high risk to fight this disease off. When I say immunocompromised, these include diabetics, lung or heart disease patients, and also hypertension. The incubation period usually, once you're exposed to a sick contact, would be anywhere between 7 to 14 days. The total illness can take 2 to 6 weeks to recover. What are the common symptoms? The symptoms you look for is very high fever, dry cough, and shortness of breath. 80% of the time it could be very mild symptoms, and then the 14% can be low serious, and then the rest could. Most of the fatal cases have been in elderly, aged more than 60, or other comorbidities that they have found in China. How to prevent this? Prevention has a lot to avoid the sick exposures, mainly with hand hygiene. Anybody who is sick have to stay home, and also when you cough or sneeze, we have to make a habit of covering our mouths and noses. Do not touch your eyes, nose, and mouth without cleaning your hands. It has also proven that washing your hands very frequently, cleaning the surfaces very frequently with bleach or any forms of alcohol or hand sanitizer would also prevent this. Treatment options, nothing so far, but there are a few drugs that are under trial. One of it is DR.MADHAVI.R, which is antiviral medication. About travel. Travel would really be avoided in this situation because of the spread in the community and also other countries. Unless it's an emergency, we would not recommend to travel. Again, social distancing has been very, very hard for some people, but that's the only way we can limit the spread of the disease. So I have had some QA questions about how to keep the children in the house. If somebody is sick in the house, yes, there's no short way. You have to quarantine them. They have to use special utensils, dishes, no sharing, and you have to wear a mask, whoever the person is sick. How long is the quarantine time? Usually until symptoms free. The fever have to be fever free for 24 hours. The cough has to be resolved. And if you have a medical facility to prove that, there are tests available that you can be tested, and 2 consecutive testing kits have to be, or testing methods have to be negative before you are disease free. Yes, all of the primary care doctors do have testing kits now. Anybody who has mild symptoms can stay home. If something is worsening, You can call your primary care doctors and they can quickly check. The turnover time of the test results is usually 24 to 48 hours. And it has been improved in past week than the beginning of the month. Another topic that I would want to bring is, okay, this is influenza season, can we also get COVID-19? Or influenza vaccine can prevent COVID-19? I don't think so. Influenza is different, and yes, people who get influenza or got infected with influenza are still at risk to get COVID-19. Some people have asked me about the food restrictions. Nothing in particular, but any antioxidant to boost your immune system would definitely help to fight off the disease. Again, drinking alcohol would prevent the illness. I don't believe so. Just washing techniques and cleaning your hands with 60% alcohol only will avoid the spread of the illness. I know again the allergy season is going to come in a few weeks, especially in some states of United States. You have to differentiate between what the symptoms of allergies versus viral fever. Usually, unless you have a hay fever related to pollen, there is no confusion, because you will not have a high degree fever, cough, or shortness of breath unless you're an asthmatic. If you have a fever and presenting like a illness, that is not allergy. You have to get to your primary care doctors. Please watch the video Being Social if you like it.